everyone, it's me, Dr. Kaitlyn Morno, and I am here with Kaitlyn Lundgren. She is new on our staff and we're very excited to have her. Kaitlyn comes to us with a knowledge about healthcare as well as weight loss. And many of you have seen all the stuff in the press about weight loss and the weight loss options that are available, including the semaglutides. And we've thought long and hard here about bringing that on board and offering it to our patients, but we wanted to do it in a safe and ethical way. And so we wanted to have someone here who had experience with it and who could really help our patients negotiate the weight loss process. So when you come here, can you explain to us kind of what our patients are going to go through? Because it's not just going to be walk in, grab some medicines and go home, right?
Right. So I'm going to do a formal consultation. I want to get a very in-depth past medical history, medications, surgeries, things that you've gone through with weight loss in the past, what's worked, what's not worked, what is your lifestyle. As great as these medications are, I need to know all of those details because there is a lot more to it that we need to dive into with lifestyle changes and everything. So we spend a lot of time together and we go through a lot of things and we just get to know one another very closely.
And one of the things that you do require your patients to do is to get blood tests, correct?
Correct.
Can you explain why that's important in this process?
Yes, we're going to look at a lot of biomarkers that are just going to tell me your overall wellness, but what are your blood sugar numbers? What do I need to know? Are you pre-diabetic? Are you in metabolic syndrome? What's your cholesterol like? All of those things we need to watch along the line. You're going to see improvements in these with the weight loss, but will you be a candidate? I need to know all the details to make sure it's the right drug for you.
Sure, because we want these patients to get the medications, but we want them to be safe while they're taking it. So
yes.
The other thing that will be required is patients will have to get their blood work checked periodically because some patients can have a reaction to the medicines, right?
Yes.
And there's been some press about that. So, but as long as we're monitoring that, we can pick up if they're having issues and we can make sure that they're treated appropriately and stop the medicines, correct?
Yes, it is not one size fits all. There are side effects. I do like blood work at least every 3 to 6 months, depending on your health. What is it doing to your cholesterol or your liver function or other things? How's your GI system tolerating the medication? So we do try to keep a close eye on all of those things.
And on average, I know this can be hard to guesstimate, but on average, how much weight can a person lose using these kinds of medications?
Yes, we've had really great results. I mean, I like to see about 1 pound a week for healthy weight loss. I've had patients, reporting 2 pounds a week, and they're doing really, really well with that. We just need to make sure it's not too much too quickly, and that it's nice and gradual.
Okay, and that 1 pound per week, that's not forever. I mean, it's going to plateau at some point, right?
Yes, we adjust the dosage based on your needs, based on how you tolerate the side effects as well. Mm-hmm. You might do very well on the lower dose. You might need to titrate up to the max dose. Everybody's so different with the way they metabolize it and it works for them.
And will patients have to take this for the rest of their lives?
Hopefully not. The goal is to get you to your goal and keep track of those lifestyle changes, that how else did we get you there, and that we can make those changes for your body so that you can maintain the weight loss. Some people treating obesity, they do find that they need it for longer periods of time, even if it's a lower dose. Okay. There's no maintenance dose, but we can see what your body needs and we can just reassess.
So it's not just the medications, it's also going to be some nutrition guidance, obviously, and exercise at some point, or
yes, we need
increasing
to focus.
Physical activity?
Yes, we want to focus on that. With the weight loss, everyone loves the weight loss, but what else do we need to realize is you're losing healthy muscle. So we want to pay attention to exercise, maintaining that muscle, increase your resistance training, and keep all of that going also.
One of the things that's coming out now in the press are all these side effects, and people are kind of freaking out about them. Can we talk through some of them? I mean, one of the big ones, and this impacts my patients a lot, is the hair loss. And I often tell people, anytime you go through a stress, you can have stress hair loss. And that could be stress from weight loss, it could be from surgery, it could be from illness. It could be from, a sad event in your family. Are you seeing patients having some hair loss?
Unfortunately, yes. I feel with patients that are losing a large amount of weight, they're losing their hair. Some of that is nutrients too. What is awesome about here is we are monitoring that, and we have the vitamin injections. We want to make sure you're not deficient in any of your vitamins and things like that. But like you said, it's stress on the body. Where are those nutrients going and things like that?
Sure. And in addition, we offer other things to help with the hair loss. So we do have supplements that can be taken at home. We offer PRP treatments, which are injections into the scalp to stimulate hair growth. And we offer even laser devices that can help with hair loss as well. So we don't want you to be thin and bald. We want you to keep your hair.
Yes.
We want you to maintain your beauty through the process, right?
Yes.
So the other thing is, obviously with weight loss, a lot of us will see our faces sort of collapse, right? I'm sure you've been seeing that, right? That's to be expected.
Yes, with the loss of the fat, you will feel like, why do I look older all of a sudden? And that is because of the loss of the fat in the face and the sagging of the skin. But there are so many treatments.
We have so many options available.
So many.
If the sagging is bad enough, obviously we have surgery with, Dr. Lou and Dr. Bacos do facelifts. If we have issues with volume loss, there are a bunch of us here. We all do injectable fillers that can help with that, whether it's Sculpture, Juvederm, or other HA fillers. There's me, Dr. Ritaka, Dawn, and Christina. We do quite a few injections for patients who are undergoing this sort of weight loss. And it can be done in a way to just make the face look refreshed.
Yes.
And still keep that healthy look.
Yes.
Without looking overdone. So
yes,
we do have options for that. And then for the other areas of the body, like we offer sculpting, which can help build that muscle back.
Yep.
So the Ozempic butt can be treated if necessary, right?
Yes,
so,
I'm very excited about the sculpting because sarcopenia, muscle loss is huge with this med. So I think incorporating that is going to be so exciting.
Yeah. So it's nice that, like I said, that we have you here to help guide our patients who are, interested in the weight loss process. But it's also good to know that the weight loss isn't just the last step. Like there's a continuation of things that need to be done to maintain the weight loss, but also to maintain your appearance. And we're here to offer all of those services.
Yes.
Is there anything else we should know about this that you can think of?
I think we touched base on so many good things. I'm free for questions if any patients even just want to shoot us Clara messages, and if they're not ready for a consultation but have a couple questions, I'd be happy to answer any of those.
And I think, again, it's not just about the appearance, it's about health. So the whole point of the weight loss is to get people healthier, to steer away from obesity and diabetes and high cholesterol and the things that can cause severe illness and lead to early death, right?
Absolutely. Yes,
Well,
we want to keep
welcome
everyone
aboard.
well. Thank you so much.
Thanks for being here.
I'm so excited.
So excited for you.